Hi, my name is Dr. Elizabeth Volkmann, and I'm the director of the UCLA Scleroderma program. I'd like to thank the Scleroderma Foundation for inviting me here to speak with you today about GI involvement in scleroderma as well as nutrition. And we'll be focusing on some common myths and facts related to nutrition and GI involvement in patients with scleroderma. So this is the presentation outline. We're first going to review how the GI tract is involved in patients with scleroderma. We'll then discuss some common nutritional myths and facts as it relates to scleroderma. And then finally, I'm going to review some nutritional strategies that can help with specific symptoms of GI involvement when you have scleroderma. So when we think about GI involvement with scleroderma, virtually all parts of the GI tract could potentially be affected by this condition. And over the course of scleroderma disease, over 90% of patients will have some involvement of their GI tract. Both the upper GI tract can be involved and the lower GI tract. And what I mean by this is when we talk about the upper GI tract, we're talking about the esophagus and the stomach. And when these are involved, patients can have difficulty with reflux, heartburn, or difficulty swallowing. And the reason being is that the muscle of the esophagus starts to not work as well. So food and liquids don't move down the esophagus as well as they once did. In addition, the connection at the bottom of the esophagus to the stomach becomes loose and stays open a lot of the time. So it's easier for food to come back up, especially if you're in a reclined position or laying down. In extreme cases, there can be narrowing or strictures of the esophagus, which is what is pictured here. And in these cases, it can become very difficult to swallow even pills. When the stomach is involved, patients can have something called gastroparesis. And what this means is that food does not empty out of the stomach as quickly. So this can cause you to feel full very easily after you eat or experience even nausea or bloating after eating. In addition, some patients can have bleeding that happens within the stomach, and we call this GAVE or watermelon stomach, and this is what is pictured here. And when this happens, there can be chronic blood loss, which can lead to anemia, which can cause you to feel more tired. But as I mentioned, even the lower part of the GI tract can be affected. So this is when there's involvement of the small intestine, the large intestine or colon, as well as the rectum and the anus. And when this happens, patients can have different symptoms. So they can have episodes of what we call pseudo-obstructions or temporary obstructions in the GI tract. There can be malabsorption, so difficulty absorbing all the nutrients and calories from food that you need. Some patients will have constipation, some will have more diarrhea, or some patients will have both. There can be even fecal incontinence or rectal prolapse. And what is pictured here is an extreme example of pseudo-obstruction of the colon. And you can see that the colon has become dilated or enlarged and full of air because things aren't able to move through properly. So now let's jump into some nutritional myths and facts related to scleroderma. And even though we're not together in person today, I want to make this session as interactive as possible. So I encourage you from home to really think about the statements I'm making and think to yourself, is this a myth or is this the fact? And I think this will help you to get more out of the program. So the first statement is there is one diet that every patient with scleroderma should consume. Do you think this is a myth or a fact? Well, I think this is a myth. And the reason being is that really there's no one diet that works for everyone, even if you don't have scleroderma. And the reason is because we are all so unique. We have different genetic backgrounds. We live in different parts of the world, where in some areas, like in North America, it's getting warmer. But in other parts of the world right now, it's moving into winter and getting colder. In addition, we all have unique cultural backgrounds and food that we've eaten in our families for generations. And then beyond these factors, when you have scleroderma, every patient with scleroderma is unique. Every patient has different disease manifestations or symptoms. Patients may be on different medication regimens. There may be unique life stressors that come up, and then even unique access to certain foods. So I really encourage you to keep this in mind because sometimes, when you go to your support group meeting, you may hear about a diet that works for one patient, but just know that that specific diet may not necessarily work for you because again, every patient with scleroderma is unique. Let's move on to the next one. How you feel after you eat is a better nutritional guide than any autoimmune diet program. Do you think this is a myth or a fact? I think this is a fact. I think that there is no diet program out there, whether it's the autoimmune protocol diet, the paleo diet, none of these diets really take into account how you feel. And how you feel is a better guide to what you should be eating than any diet program or even anything your doctor tells you. So, one way to help kind of tune in to how you feel after you eat can be to keep a food diary. And I really encourage you to do this because I think it can help you identify patterns. So, help you understand what foods nourish you and what foods may be causing some of your symptoms that are troubling you. So, it can seem very tedious at the beginning, but once you get into the habit of doing this, I actually find that many of my patients enjoy it and they just keep doing it indefinitely. But I would say that at least for a 3 to 4 week period, write down everything that you eat over the course of a day, and then write down how you feel. And it may not just be your GI symptoms, but write down how your mood was that day, how your energy was, what was your sleep like, all of these things. Are you having brain fog? Keep all of these symptoms in mind because the only way you're going to be able to identify these patterns and know the triggers for specific symptoms are to really go back in time and look at this diary. And again, this is probably a better guide than anything you can find on the internet because it relates specifically to you. But sometimes, even when we keep the most detailed diary, it can be difficult to figure out what is the trigger. So you may be thinking, okay, I'm not sure, it could be dairy, but on the same day I had dairy, I also had gluten. I'm not really sure which one it is. And this is where elimination diets can be helpful. And the foods pictured here are some of the common triggers for symptoms for many patients with scleroderma. And when you do an elimination trial, you eliminate the foods that you think could be problematic. And you do this for about a month. And I would encourage you to do this with a nutritionist who's well trained or with your doctor so that they're monitoring you closely, making sure you're getting all the vitamins and nutrients and calories that you need during this time. And then what you're going to do is then slowly reintroduce those foods. And you want to do it very mindfully. So you do one food at a time, and then you keep track of your symptoms. And you not only keep track of symptoms, but also where the food came from. So if it's dairy, some people can do okay with some yogurt or creamer in their tea, but they can't do cow's milk. So write all of this down and just keep in mind that even if you identify, dairy as being a potential trigger, sometimes what can happen is the relationship between how you feel after you eat can change. So it's a dynamic process. So I have many patients that are on a specific diet and they're doing well for years. And then all of a sudden, something that, used to be able to be tolerated is no longer tolerated. And this can happen for a variety of reasons. One of the most common is your doctor starts you on a new medication, and that medication can have some GI side effects. And you may have to reconsider your diet at that point. So just keep in mind that this is an ever evolving process. So this diary can be very helpful to just keep anytime you start to develop more symptoms, go to that diary, look for patterns of things because again, it can change over time. And try to focus on what you can eat. A lot of the autoimmune diets out there really focus a lot on eliminating things. And when you think about kind of depriving yourself of things that you previously loved, it can generate some negative emotions in your body. And some patients will actually start to limit their social experiences around food. They'll be afraid to go out to eat with their friends. When they're cooking for their families, they won't feel as much joy as they once did because they can't eat the same food. And this can be really frustrating for patients. But I would try to focus yourself on the foods you can eat and what will nourish you. And I also encourage you to speak out in social situations. If you're out to dinner with a group of people, don't be afraid to speak up and say, I can't have this specific food, or, speak directly to the chef to make sure that you're getting exactly what you need. This is not being pushy. This is really putting yourself first. And you can also, in this process, teach others about their diet. Sometimes, your whole family benefits from this because they start eating healthier too. So, really, this doesn't have to be a negative experience. It can actually be something positive that brings more fulfillment to your life and to the people around you. Let's go to the next myth or fact. I must eat a low FODMAP diet forever when I have scleroderma. This is also a big myth, and I think this is one of the biggest myths out there. The low FODMAP diet was never meant to be used forever in any patient with any disease. So what are FODMAPs? FODMAPs are short chain carbohydrates that move through your intestines undigested. So they're a source of fiber in the body. And a low FODMAP diet can sometimes alleviate GI symptoms, not just in scleroderma, but in other diseases like irritable bowel syndrome. But not all FODMAPs are bad. So here is a list or a picture of some high FODMAP foods. And you can see here that obviously sugar-free candy is not something that's probably very helpful. But broccoli, artichokes, avocado, these are actually healthful foods. And so the idea of the FODMAP diet was to eliminate all of these foods that are high in FODMAP, but then to slowly reintroduce one at a time the foods to see what you can tolerate. And sometimes you may not be able to tolerate a raw form of the food, like raw broccoli, but if it's cooked well or in a soup or pureed, you may be able to tolerate smaller amounts. So really an individualized approach to the low FODMAP diet is best, because keep in mind, many of these FODMAP foods contain prebiotics, which we're going to talk about a little bit more later in the talk, and this helps support a healthy balance of gut bacteria. And cooking these FODMAP foods can actually improve your tolerance of them. So keep in mind, the low FODMAP diet is not meant to be done forever, and you want to kind of give yourself trials of different FODMAP foods prepared in different ways to see what you can tolerate. How you combine the FODMAP foods with other foods also makes a difference here. So if you have a meal that's heavy in fat and protein, like a pasta dinner with meatballs, and then after the dinner, you decide to have a healthy bowl of berries as your dessert, this could seem like a good option, right? It's probably better than cake, but it can actually cause a lot of symptoms in your gut. And the reason is that when you're eating heavy proteins or fats, your gut starts to slow down to be able to digest those foods. But berries and simple sugars should be digested pretty quickly in the GI tract. And so if you're combining those foods, the berries kind of stick around and they can start to ferment and form more gas in the gut. So if you're going to have a raw form of a FODMAP food, you want to have it separately and not in combination with a heavy fat or protein meal. And this can make a big difference in how you feel. All right. Next myth or fact, probiotic supplements will cure my SSC GI symptoms. Do you think this is a myth or a fact? So this is another myth. And I know that probiotics are very popular right now, but I think it's important for us to keep in mind the evidence. So there's really only been two relatively high quality studies that have been done looking at probiotic supplements in patients with systemic sclerosis. And in both of these trials, patients were randomized to either getting the probiotic or getting placebo, and they didn't know which one they were getting. So it was a blinded study. And they found that over the course of 2 months in both of these studies, there was no difference in GI symptoms at the end of these studies. And this to me suggests that we probably don't have the right probiotic yet for scleroderma. These are just general probiotics that are on the market. And keep in mind too that this industry is not regulated. So when you take a probiotic that you buy in the supermarket, there's really no oversight saying, okay, this is really what you're getting. It's going to make it through your GI tract to the place that it needs to be. But I do think that the balance of bacteria in your gut is very important to your health. And there's a lot of studies now that show that if you have a higher abundance of bacteria that we think cause inflammation, and we call these pathobiont bacteria, and lower amounts of the healthy bacteria, we call these commensal bacteria, this can generate inflammation in your gut and even outside of your gut and cause different autoimmune diseases. We did the first research study on the gut microbiome in patients with scleroderma some years ago at UCLA. And what we did is we had patients undergo a colonoscopy, and we had patients with scleroderma, and we had patients who didn't have scleroderma. And we sampled from two different parts of the colon. So we sampled from the cecum and the sigmoid areas of the colon, and we collected the bacteria that we found in those areas, and we compared the scleroderma patient's bacteria with the healthy patient's bacteria. And what we found were that there are significant differences in the abundance of specific bacteria between the patients with scleroderma and the healthy controls. So the green bars here signify the bacteria genera that were more abundant in the patients with scleroderma, and the red were more abundant in the healthy patients. So there were a lot of differences, and I'll just call your attention to a couple of notable ones. So Streptococcus, Fusobacterium, these are considered those dangerous pathobiont bacteria. They were higher in the patients with scleroderma. Whereas things like Fusilibacterium, Clostridium, we think of these as more healthy bacteria, and these were actually higher in the control patients who didn't have scleroderma. And then interestingly, Lactobacillus was actually higher in the patients with scleroderma. And lactobacillus is what's in the majority of probiotics that are out there on the market. So again, this to me suggests that we really probably don't have the right probiotic yet specific for scleroderma. We've also shown that the degree of dysbiosis or imbalance in the gut bacteria can be associated with symptoms. So we and other investigators have found that patients with higher levels of certain bacteria and lower levels of other bacteria are more likely to have increased GI symptoms. So clearly these bacteria are important in regulating our immune function and also how we feel if you have scleroderma. So, until we have the right probiotic or medication to improve the bacterial balance for scleroderma, there's a lot that you can do as a patient with your nutrition to help restore this balance. And one thing that's relatively simple to do, and probably if you're going to make one change after you hear this talk, this would be the change to make, is to avoid processed foods. And processed foods really just means chemicals being added to foods to change the food in some way. So either to prolong the shelf life of the food, to change the flavor in some way, or the coloring. And the problem with this is that this can also disrupt the bacterial balance. So if you're not really sure if a food is processed or not, what I would encourage you to do is look at the back of the food label and see how many ingredients are listed there. And if there's more than 5 ingredients, it's highly likely that that food has been processed. Specifically, if you read one of the ingredients and you can't even pronounce the name, you've never heard of it before, it's a high likelihood that that food has been processed and it may not serve you well. So these were some of the studies that have been done looking on the left at specific food additives, how they affect the microbiome, if they cause bacterial overgrowth, and then how that ultimately affects the host. So causing inflammation, metabolic syndrome, obesity. And some of these food additives you may have heard of, like aspartame or saccharin, but most of the time these are things you've never heard of because again, they're chemicals. So if you're going to make one change to your diet after the talk, this is probably the simplest one to make that can have a pretty profound effect on your bacterial balance in your gut. Added sugars is also something that can disrupt the balance of gut bacteria. So if extra glucose or fructose is added to the food you're eating, this can lower the gut bacteria diversity, meaning you have a less variety of different bacterial species. In addition, it can lower the amount of healthy bacteria and then even increase gut permeability. And this is something that is commonly referred to as leaky gut. And what this means is that the protein barriers that help kind of keep things within the intestines start to break down. And so inflammation in the gut can leak out into the circulation. And again, this can be related to having too much sugar. Same with red meat. So, particularly in the United States, a lot of the animals that are killed for human consumption are given hormones and antibiotics. And there's now emerging evidence that these things can really affect not only the animal's immune system, but also yours. And there has been studies demonstrating that red meat consumption is associated with an increased risk of rheumatoid arthritis as well as multiple sclerosis. In addition, keep in mind that when you have scleroderma and you have difficulty with swallowing, red meat is a big trigger for choking, and you have to be really careful. And then if you just think about the nutritional benefit of red meat, it's pretty low, right? It is a source of protein, vitamin B12, but you can get these in other ways without getting the saturated fat, without the risk of the hormones and antibiotics that the animal is getting affecting your health too. So I think red meat is something I would probably avoid or limit if you can. And then there are natural sources of probiotics out there. So instead of investing, $50 to sometimes $100 a month on a probiotic supplement you buy in the store, you can try to get this more naturally. So you can make or buy kefir. Yogurt is a great source. Anything fermented, like pickled vegetables, these are going to have natural probiotics. So naturally, these healthy, good bacteria. And a lot of studies have shown that if you have, yogurt, you're going to get more of the probiotic benefit than just a pill with the probiotic in it. And then you get the other benefits of the food too. So with yogurt, you're going to get calcium and vitamin D that's good for you, and you won't get that from having that probiotic pill. And then prebiotics. So remember, we talked about the FODMAPs having a good source of prebiotics. And prebiotics are substances like inulin that basically, again, are not digested, but the bacteria will eat them, and this will help improve the balance of the healthy bacteria. So again, you may not be able to have raw asparagus, but you may be able to have it cooked or in a soup and get a little bit of prebiotics in what you're eating. All right, myth or fact? If I'm losing weight, it must mean I'm not eating enough. Is this a myth or a fact? So this, I think, is also a myth, and it's something that commonly affects a lot of patients with scleroderma, where you may be eating the same amount of food that you've always eaten in your life, but you just can't keep the weight on. And this can happen specifically at later stages of the disease when you've had scleroderma for a while. And so it might not have actually anything to do with you not eating enough. Whenever we talk about weight loss, we have to think about sort of the energy balance. So you lose weight when you're not taking enough calories for the amount of energy that you're putting out. So we don't just have to address what you're putting in, we also have to address how much energy you're putting out. And there are issues related to scleroderma that make you use more energy over the course of the day. So for example, If you have lung disease and have difficulty breathing, this will take more energy for your body every day. If you have some physical challenges such as arthritis or muscle inflammation or even joint contractures that cause you to mobilize or ambulate in a more difficult way, this takes more energy because it's not the most efficient way to move. In addition, the inflammation from the scleroderma itself can cause you to need and use more energy. If you think about it, if you have something like the flu, you're going to feel very tired, right? And this is because there's all this inflammation going on in your body. When you have an autoimmune disease like scleroderma that's not well controlled, this inflammation can be there all the time. And again, this consumes more energy and it's going to make you feel tired. And then finally, stress is a big source of really sucking away your energy. If you are worried about your disease or worried about something in your life, this takes more energy. So, all of these factors combined could lead to you requiring more calories than you once did. But then there's also causes of decreased energy intake. So you may have something called malabsorption. And this is where you may be eating a specific food, but you're not able to extract from the food all the nutrients and vitamins and calories that you need. In addition, many patients have decreased appetite, and there's a lot of different causes of this. So it could be related to the scleroderma itself. For example, if you have gastroparesis, that slow emptying of the stomach and getting full very easily, you may have less desire to eat because you just don't like that feeling of being bloated. You could have a side effect of a medication where every time you eat, you have to go to the bathroom right away. And then you think, well, it's just easier if I don't eat. If you have depression, this can make you have lower appetite. And if you have difficulty swallowing, this can make you less likely to want to eat. So, how to gain weight when you have scleroderma? You have to address both sides of the equation. So, if you're talking about how to address the causes of increased energy expenditure, we're talking about getting treatment for the scleroderma. So, your lung disease, arthritis, myopathy, trying physical therapy to improve your ability to move, pursuing treatment that reduces inflammation, and then including some interventions in your life that can help you deal with the stress that comes with having a serious autoimmune disease and just the stress that we all experience in life. And then finally, to be able to increase the caloric intake, you want to talk to your doctor about treatment for malabsorption if this is an issue for you. You want to also be trying to eat easily to digest foods like soups, having smaller, more frequent meals, particularly if you have slow gut motility. And then finally, healthy fats can be a great way too to get more calories in. And the reason is that fats, like things like oils, take up less space in your stomach. So they're not going to make you super bloated, but they're packed with a lot of calories and a lot of other good things too. So there's a number of plant oils that are great. Olive oil is probably one of the best ones, flaxseed oil, avocado oil. All of these have other benefits for your health too, in addition to giving you more calories. And some people forget too that even the dark green vegetables have a good amount of these healthy oils too. So if you're able to tolerate kale or collard greens, even if they're cooked really well or pureed or put in a soup, this can be really healthy for you. And then also keep in mind that if you have malabsorption, this can cause vitamin deficiencies. And you want to be talking to your doctor, a healthcare provider, to figure out which vitamins you're deficient in. And they can do blood tests to be able to determine this. So I wouldn't recommend just blindly taking vitamins because there's actually a risk of having too much vitamins in your body. But I would talk with your doctor and help them guide you through the process of figuring out which vitamins are low in you and which supplements you need to take. And then keep in mind that, again, the supplement industry is not regulated. So you want to make sure that you're getting good advice about which vitamin brands you should be using. All right, myth or fact? My body can digest more easily when I eat in a calm state. Do you think this is a myth or a fact? So I think this is a super fact. And the reason is that, digestion can only happen in your body when you're in a calm place. And we call this the parasympathetic state. So there's kind of two nervous system states in the body: parasympathetic, which is sort of the rest, digest, relax state, and then the sympathetic nervous system state, which is really about fight or flight, like getting away from danger, stress when you're in traffic. Those situations are not ideal situations to be eating in because the body really isn't in the right state of mind to be digesting food. And there's now more and more evidence of this brain gut connection, that how, the stresses in your life, they not just affect your mood in your brain, they affect kind of the mood in your gut and how well you're able to digest food. And this is something that I think is really important because you could be eating the highest quality diet out there, but if all your meals happen in a rushed way, when you're in your car, when you're doing work at the same time, you're not going to be getting all the benefits from the food you're eating. So these are kind of simple things, but I think they can be really helpful. So to create a peaceful environment for eating. So, it's really common when you get home after working a long day and maybe the people in your house are really hungry that you just sit down right away and start eating. But I would encourage you to take 5 minutes for yourself, and you could change into something comfortable, because remember, you don't want to eat in any clothing that's tight fitting because this can actually disrupt sort of digestion. You also want to make sure that your eating space is clear of any kind of stressful triggers. So I wouldn't recommend eating at a table where you see this big stack of bills and you're, worried about paying these bills. You want to kind of clear the setting so that it's calm for you. You also want to make sure that you're, sitting upright when you're eating. When you have scleroderma, this works to your advantage. The gravity will help you in moving the food down. It's almost like retraining, how to eat, because I think we teach our children to, sit upright, eat their food, not have any distractions or iPads. But then as adults, we kind of do all these bad things. We eat in bed, we eat in cars, we eat in front of our computer. And this is really not good, but particularly when you have scleroderma, you want to be making sure you get as much as you can from the food you're eating and making changes to your environment, eating only till you feel full. These are strategies that will help you with digestion. And then after you eat, it can be very helpful to take a gentle digestive walk. This doesn't have to be a vigorous walk or a run. In fact, I would not encourage that. This is more of a gentle, slow walk you can do on your own or with your family. And again, this might help to kind of stimulate gut motility and help with the beginning of digestion. I wouldn't recommend taking a warm bath or shower directly after eating. And the reason is because if you take a warm bath or shower, the blood flow is going to go to different parts of the body, the extremities, you start to get warmer. You really want, after you eat, all the blood flow to go just to the gut. So I would shower, bathe before you eat. And then again, like we always say, try to stay upright for at least 2 to 3 hours before lying down, particularly before bed. And this can help a lot with reflux symptoms. So to conclude the talk, we're going to go through some specific GI symptoms and some nutritional strategies for dealing with them. And these strategies are by no means meant to replace the advice of your doctor or the medication they may be prescribing for you. These are just some ideas that might be able to help you. And like this entire talk, really, if something resonates with you or you think it will help you, try it out. If it doesn't resonate with you or you've tried it before and it doesn't work, just discard the suggestion. Because again, you are the best guide when it comes to managing your nutrition. These are just some suggestions that I, as a scleroderma doctor, have found helpful for some patients. So reflux. I think everyone here is probably aware of the triggers for acid reflux, probably because you've all experienced it at one point or another. So you want to avoid fried food, poor quality vegetable oils, red meat, coffee, hot spices, alcohol, citrus fruits, and tomato, as well as vinegar. But as much as it is to avoid these foods, there's also foods that can be helpful to consume more of that help with reducing reflux symptoms. So, soups, especially vegetable soups that are not spicy, can be helpful. Gluten free oats. Yogurts can also have kind of a soothing effect there. And if you can't tolerate dairy, there's a whole lot of non dairy yogurt options, right? There's oat milk, coconut milk, soy milk. There's a lot of different possibilities now if you can't tolerate a cow's milk dairy yogurt. Avocado. And again, if you can't tolerate it raw because of the FODMAPs, you can cook this. Grilling avocado is very delicious. Spinach, again, you can cook this or maybe put it into your smoothie. Cucumber, liquid chlorophyll. And then for teas, chamomile tea can be a nice tea to have for, again, reducing the reflux symptoms. Bloating is another problem for many patients with scleroderma. And I think there's some simple things that can often help patients. So be mindful of the water you're drinking during the day. If you start to get dehydrated and the colon doesn't get enough water, it's not going to move as well, and this can cause more bloating. So make sure you're drinking enough water during the day. If you're having an episode of severe bloating, avoid white foods. And I say this because it's usually simple to remember, but this would be white bread, white rice, white sugar. These are things that don't help bloating situations. And then avoid these specific food combinations that we spoke of before. So if you're going to have a simple sugar, a bowl of fruit, have it on its own and don't have it in combination with a meal with a lot of fat and protein where your gut has to work harder to digest the food and it starts to slow down. And then this is something that I think gets overlooked, this fiber issue. So if you were to go on the internet and just Google, what should I eat if I have constipation and bloating? For people without scleroderma, sometimes fiber is what does the trick. And the reason they're constipated is because they're not having enough fresh fruits and vegetables in their diet and fiber. And they start taking a fiber supplement and they become more regular. But when you have scleroderma, it's not the same as everyone who doesn't have scleroderma with regard to fiber. Sometimes if you have too much fiber, this can actually cause more bloating, especially if it's sort of an unnatural fiber like a Metamucil. So you want to make sure that you're having kind of small amounts of more natural fibers like ground flaxseed and titrating it to what makes sense for you, because you might not be able to tolerate the same amount of fiber in your diet as someone who doesn't have scleroderma. And so just keep that in mind when you read about what to do if you have constipation. The answer is not always more fiber. And then, sometimes if you're really bloated during the day, I would consider making one of your meals a liquid meal. So this would be having a vegetable soup, pureed vegetables, a green smoothie if you can tolerate them. But you're getting in the same amount of calories as you would be as if you, let's say, ate the salad with these vegetables, but it's in a more easy to digest form and the body doesn't have to work quite so hard. And sometimes just giving your digestive tract that little bit of a break can help alleviate some of the bloating. And then make sure, again, that you're warm before you eat. If you eat and you're really cold, your sympathetic state is going to get activated. And this, again, is not the right state to be in when you're trying to digest your food. There's some herbal remedies that can sometimes be helpful for patients. And again, always talk to your doctor before you start any kind of herb or supplement. But some that could be helpful are things like chamomile and lemon balm. And in addition, aloe vera juice can sometimes be helpful too if you want to add that to your morning water. This can not only help with the bloating, but in some patients it helps with reflux too. Diarrhea can be very tricky, especially when patients have sort of this alternating constipation and diarrhea. The treatment, though, in terms of nutrition is very similar, but you really want to avoid raw fruits and vegetables when you're having severe diarrhea. You want to make sure you're getting water that has electrolytes to help you stay hydrated. Avoiding greasy foods can also be helpful. And then again, similar to what we've talked about with the other issues of the GI tract, having more soft foods can be easier to tolerate when the GI tract gets kind of flared up. So this would be oatmeal, pureed winter squash can sometimes be really easy to eat if you cook it well, and it also is a good source of vitamin A and vitamin K. So we're gonna stop to summarize. And again, I hope that you enjoyed this talk, and just keep in mind that this is an ever evolving process during your journey with scleroderma. And if you think of other questions or wonder, about some nutritional issue, is this a myth or a fact? You're welcome to contact the Scleroderma Foundation, and they can reach me and I can try to provide some advice. But I want to summarize that how you eat can have an incredibly huge effect on how you feel when you have scleroderma. And I believe that an individualized approach to your nutrition is likely to lead to better outcomes than to just going on the internet and blindly following the autoimmune protocol diet or some diet like that. Really, if you develop a relationship between how you feel after you eat, this is more powerful and gives you more knowledge about what is right for you than anything your doctor or a book or a blog could even tell you. And I would try to eat when you feel relaxed and you feel warm. And if you're going to avoid, any foods, the things that are probably most important to avoid are processed foods, added sugars, and red meat. If you have a lot of bloating, the raw vegetables can be really difficult to digest. So even though a salad seems really healthy and nice on a warm summer day, it's really going to be difficult for you if you have a lot of bloating. So it's probably better to cook the vegetables before you eat them. And then I would also consider exploring a plant-based diet, particularly if you have difficulties with swallowing meat. And I want to thank you so much for your time. And again, thank the Scleroderma Foundation for inviting me here today. I wish you all the best, and I hope that we can meet together in person next year. Take care.